Hi, thanks for making time to listen to my presentation regarding my research proposal. I'd like to start by explaining that the focus of this research proposal is to provide a research activity that can be completed through the course of a Master of Clinical Psychology program at your university. The title of the research proposal is Length of Psychologist Experience in Therapist Drift, the Moderating Effects of Psychologist Openness and Conscientiousness. So to the background or the problem. Therapist drift occurs when a psychologist drifts away, or research suggests when psychologists drift away from providing evidence-based therapies. This occurs when a psychologist, due to negative experiences, choose to start dropping out elements of therapies or even stepping away from therapies completely. So therapist drift, research suggests, relates to safety. So essentially, rather than going into a difficult situation, which could be fraught either for themselves or for the patient, a psychologist stops providing that research-backed therapy. Therapist drift occurs in diverse therapies, according to research. It can occur in cognitive behavioral therapy, it can occur in exposure therapy or dialectical behavior therapy. Therapist drift also, research suggests, occurs in treating diverse conditions. So it can be used when treating eating disorders. It can occur when in post-traumatic stress disorder treatment or in panic disorder treatment. Therapist drift is problematic because firstly it undermines the basic model of clinical psychology, which is the provision of evidence-based interventions to treat mental health disorders. So it conflicts with that model, which then leads to therapist drift causing reductions in the benefits that individuals gain from receiving therapies. And indeed, research suggests that therapist drift may actually leave patients worse off after treatment than before they were before the treatment. Therapist drift is caused by both clinician and patient factors. My interest is actually what therapists are doing or what is happening with therapists that they move into those practice. So I'm focused on clinician factors. There are real limitations on research in therapist drift. There's a lack of research in Australia, according to research, and there's a lack of research regarding personality traits and how they affect therapist drift. I should say that there's a broad range of factors that can actually affect therapist drift. So there's things like personality factors, the length of time that a clinician's actually been providing services. There's the clinician's gender. There can be the clinician's orientation of their practice. So there's a lot of things that contribute to a therapist or a psychologist moving into therapist drift. One factor which is research suggests associated with therapist drift is length of practice. So as a therapist is operating as a psychologist for a longer and longer period of time, they have a number of negative experiences which then inform their choice to stop providing parts of a therapy. An interest I have is the role of personality in this. So the personality domains of conscientiousness and openness may, I believe, relate to therapist drift. So conscientiousness relates to how faithfully a person follows the rules and requirements and the expectations of a particular function, whereas openness relates to a breadth of mental and an openness to new things, basically. So as new experiences occur, people with a high level of openness respond to those, which may well feed into therapist drift. So what this research proposal is looking to do is actually test, in an Australian context, the relationship between therapist drift and the number of years that a psychologist has been practicing. And then it also wants to explore the roles of those two aspects of a psychologist's character or personality and whether they influence the move towards therapist drift. So the research aim is to investigate whether conscientiousness and openness moderates the relationship between psychologist therapist drift and length of practice experience. The research design will be a cross-sectional study, so data will be collected once an analysis done from that. The analytical method will be a moderated regression. The independent variable will be psychologist experience measured through completion of demographic information, including how many years a person's psychologist has been practicing, the moderated variables of the personality traits of openness and conscientiousness will be measured through the NEO 5-factor personality scales, subscales, and the dependent variable would be measured through the evidence-based practice attitude scale 50, which is a 50-item scale measuring practitioners' attitude towards evidence-based practice. The method will be purpose of sampling. I'll advertise on the Australian Psychological Society website and other relevant sites and do follow-up phone calls to promote participation. The target sample is 107 participants, which has been calculated through GPower to identify a medium effect. The timeline has been designed around the Master Clinical Psychology program. So in the research proposal unit, I'll complete the ethics clearance of data analysis plan, pre-registration of proposal, and draft an abstract introduction to methodology. During the research project unit, I'll have the survey open for the first 6 weeks of the unit, then I'll conduct the data analysis and draft results and discussion sections. Then I'll consolidate and draft thesis for review and potentially draft a journal article. It's expected to be a low cost project. The only costs are going to be the cost of any measurement instruments and any advertising costs on websites. I'll negotiate those with the relevant parties and keep it within a budget of a personal contribution on my part of $500. So feasibility, I believe it's highly feasible because it's been designed to comply with the Masters of Clinical Psychology program as I've just outlined. Significance, I think it's very significant because it goes to the fundamental character of clinical psychology, delivering evidence-based interventions to support people with mental health issues, which I then think has implications for individual patients, the discipline of clinical psychology, and I believe the broader community. Why me? Because I believe I have expertise to actually do this work. I have a passion for understanding how different factors interact to affect the effectiveness of interventions. I have a personal capacity in terms of the time and the resources to do it. I believe I have significant fitness for practice. Through the GDP and GDPR, I've met all the policy requirements in terms of performance, behaviour and compliance, and I have the health to do it. So thank you for listening to my presentation. Here's my references. If you have any questions, please contact me.